Good morning. We'll get started in a minute or two here. We'll let folks come on into the webinar. All right, so it's almost 1 after, so we'll get started here. This session will be recorded. Thank you all for taking the time to join me this morning as we go over HCAHPS as part of the value-based purchasing. This is our third of 3 sessions on these items. My name is Charlie Breznicky. I'm a director at Symmetry, and I'll walk you through VBP. We'll go through an overview of what it is, but then we'll get into really what the HCAHPS are, the measures in there, and how you can improve in those. So there's a lot of information that we have to cover over the next 29 minutes. The basics for VBP, as a reminder, it's going to go live January 1st, 2023, impacting all Medicare certified agencies in the 50 states, DC, as well as all US territories. CMS really expects a savings here of about $3.3 billion in the savings, really coming from unnecessary hospitalizations and patients coming to home health as opposed to SNFs. There were savings seen in the initial model, and that was only in 9 states. So once it rolls out on a nationwide level, they're expecting the savings to be even larger. The baseline year at this point will be 2022. We're waiting on the final rule to clarify that, but that is the year that agencies will be compared against on each of the measures in VBP. Additionally, agencies will compete on a national scale, either in a large or a small volume cohort, and that is based on the 2022 census. And there are some questions. If you have any as we go through, feel free to put them into the chat. I'll answer them as we go through or at the end. So about the cohorts, that is based on the census from 2022. It is really if you are exempt from the HCAHPS, you would be placed in the smaller cohort. If you have 60 or more unique Medicare beneficiaries at the end of 2022 that you served, you'll be in that large volume cohort. So the recording will be available after the session that will be sent out. So let's get into the metrics here that will be in value-based purchasing. There's 3 overall groups: claims-based, and OASIS-based, and the HCAHPS. We're really going to be focusing on the HCAHPS here. So these bottom 5 items here, the top 3, professional care, communication, and team discussion, are aggregate. They're composite questions. Overall rating and the willingness to recommend are individual standalone items. And we'll go through the composite items, what are the questions in there, as well as how might you be able to improve in each of these. The HCAHPS category will make up 30% of the total performance score, so potential 30 pool points here. And each of the measures in the HCAHPS will account for 6% of the total performance score. So just as a reminder as to how you'll get scores, agencies will get scores based on their achievement or improvement threshold. They'll have a baseline score, and that will be compared against the achievement threshold, which is the median or the 50th percentile of agencies on each measure. You have to score above that to get any points. And for the improvement threshold, that is your individual agency performance in the baseline year. So remember that baseline year is 2022. You have to score above these thresholds to get any points on that measure. Now, when we look to the right side, we see the benchmark. The benchmark is the top decile, that's that top 10% for each measure. If you're above the benchmark, you're going to get the maximum of points. You're going to get 10 points, which is the maximum for each item. If you're below below the benchmark, but above the threshold, you will get points anywhere from 0.01 to 10 for achievement, and for the improvement, you'll get 0.01 up to 9 for the depending on how close you are to the benchmark. So the key item here is you're compared against other agencies for that achievement threshold and against yourself for the improvement threshold. So once each metric has points, they will be summed and applied against a weighting average that we had shown before. And agencies will have a numeric score from 1 to 100, 100 being the highest score, and the higher scores you're more likely to get that positive payment adjustment. So every agency will get a score based on the weighted sum of the performance scores for each quality measure. Now, if there are measures that don't meet the minimum threshold, so for the OASIS and the claims base, there must be 40 of those. If that is not met, then the points will be redistributed. If you don't have enough HCAHPS, so not enough surveys were sent back, those points will be redistributed. So for those smaller volume agencies that are usually HCAHPS exempt, you may get your points from the claims-based and the OASIS-based measures. So let's get into what's actually going to be included in each of these measures here. So there are questions here. Before we get into those, I will answer that. We're doing HCAHPS in-house due to a low census. So if you have if you're HCAHPS exempt, so if you have 59 or fewer unique Medicare beneficiaries that are served in a year, you have to submit an exemption to not perform the HCAHPS. So if you think that your census is going to be below that, you would have to submit that exemption. I can follow up with the person who asked this afterwards on how to submit that. I'll reach out, I'll send you how to get that information and how to do that. So when we look at the HCAHPS, just a few items here to know how this calculation occurs. It will be based on the surveys, and the numerator is the number of respondents who gave the most positive response. So if it's the best score, only that counts in the numerator. So you'll see ones that say never, sometimes, always. It's only the always or the most positive response that counts in the numerator. The denominator will be the total number of respondents who answered the question. So you want to get that survey response rate up because you want to get folks who are going to give those positive responses. And we'll talk about how to address each of these items in here. But that's just so you know what's included in each one. So the key thing here, taking away this, is that most positive response. When we're looking at these items, keep that in mind. These are the questions included in professional care. There are 4 altogether, and really it's asked about, was care provided in a professional way? So looking at the most positive responses for the first 3, the question is always, or the response you want to see is always. For the last one, the response you want to see is no. And what this is asking about is, did staff seem informed and to date? Did staff treat you gently, with courtesy and respect? So if those are answered always, that's going to be the most positive response. You're going to get a positive score there because these will be in the numerator. And then the last one here, and this one asks, did you have any problems with the care you got through this agency? The positive response here is no. So if anyone said yes, you want to, hopefully they left a comment in the survey, and you can have a look at that, because hopefully they elaborated on that, what that problem was, so you can identify that and then work to prevent that from happening in the future. So how to address some of these items? By being informed and up to date, make sure that staff are aware of the plan of care. So they know where to find it, they know what maybe the patient's wound care is, what meds they're on, who else is involved in that case. A quick review of the chart before someone goes to see a patient for the first time can help to keep them informed and up to date. So make sure your staff are aware of that, know where to find the plan of care, and are having a look at the last visit notes. They know what they may need to address in this visit. Additionally, ask about any recent appointments since the last visit. Not just if they had one, but what was the outcome? If the patient went to the wound center, we can ask, I understand you were at the wound center 2 days ago. How did it go? We're going to do your wound care. We have not received a new wound orders. Did they tell you anything at the wound center? This one, it shows the patient that you're aware of what's happening in their care, but it keeps them engaged as well. And then to address items around, did the agency treat you gently? As much as possible, prepare the patient for any potentially uncomfortable procedures. This may be the wound care. We want to explain to them that it may be uncomfortable. We want to educate them on taking their pain meds maybe before therapy arrives, so they can complete all of the therapy. We may want to recommend they take their pain meds prior to the nurse arriving, so that when the nurse is going to perform the wound care, it's hopefully a little less painful. Additionally, when we're performing any of these procedures, we want to ask them how they are tolerating it, making sure that they're able to manage it as we go through that procedure. So keeping them engaged, keeping them informed of what they may experience as a procedure occurs. We don't want them to go sometimes the fear of the unknown can just be much worse than the actual event. So we want them to be aware of what they may expect as we do a procedure. Additionally, when it comes to treating a patient with courtesy and respect, address any fears or concerns that they have. If they're newly diagnosed with a chronic illness, ask them, what are they concerned about? Maybe they had a family member that passed away from a similar illness, and they're worried that it's going to happen to them. Or they have a wound that was infected, and they're worried that they may lose a limb. Acknowledge any of their fears and concerns. Talk with them about what they could do to prevent exacerbations of a chronic illness, how to monitor for signs of an infection, but address those fears and concerns, acknowledge that they are real for that patient, and then talk through those and support them as they experience that. If need be, and if it's possible that you have the resource, mental health professionals can help with that as well. Additionally, we're going into the patient's home, so we want to make sure that they're going to be there, and we want to work around their home and around them as much as we can. So we want to ask them when they want to be contacted to schedule their visits. Can't always be done that first time because we don't know, but when we do make that initial call or we're doing that initial evaluation, we want to ask the patient when they want to be seen. As much as we can to try to accommodate in their needs. We're respecting their wishes. Maybe they don't like getting up before noon. So we're going to call them in the evening before to schedule a visit, and as much as we can, schedule that in the afternoon. And then if they answered yes to any problems with care, we want to try to identify in the comments what that was. But as the patient's receiving the services, we can ask them, are we meeting your needs? Is there anything that we could do better to try to address any problems up front? If the case manager or the clinician is not able to address those, get the manager involved in that so they can make a call or even a visit if need be, to try to address any of the patient's concerns or problems. The next series of questions is around communication. And again, I just want to show you what are the most positive responses here that we're looking for that will be included in the numerator. So were you aware of what care and services you would get? We want to see a yes. The next three, were you informed? Were things explained in a way easy to understand? Did the agency listen? Always is the most positive response. And when you called the agency, did you get the help or advice you needed? We want to see a yes. And then when you did call, how long did it take? Same day is that most positive response. We know that that can't always happen, but as much as we can, we want to try to address the patient's needs on those days. So when we get into some of the strategies on how to improve in these areas, the first one is around making sure the patient knows what care and the services they're getting. If a welcome call is done by intake, you want to review what has been ordered. So I'm Charlie from ABC Home Health. We have a referral to Start Home Health. The physician ordered nursing, PT, and OT. Talking about that, making sure that they're aware of that. And then whoever does the start of care should follow up on that. And if they know what day another discipline is going to go, share that and be like, you should expect a call from a physical therapist to schedule a visit. I understand they're planning to see you on Friday. So keeping the patient aware of that, or even if you're partway through the episode of care and you want the patient fell, you want to get PT in there, making them aware of that, keeping them up to date on the services available and who has been ordered, just keeps the patient engaged in their care and is more likely to yield a positive response here. And then, were you made aware when someone would arrive at your home? Take a look at your scheduling processes. Really around one, making sure that staff are calling patients and that they're calling the right phone number. Because if they're calling and they get a voicemail that is full, we don't know if that's the patient's real number or not. Numbers can be transposed. So if we're not able to get a hold of that patient, we want to call around maybe to an emergency contact to a physician's office, make sure we have the right number to schedule that visit. And then when we do get into the home, verify that that is the best number to call to schedule a visit. And then asking the patient, when's a good time to call? Like I said, when do they want to be called? Patient may say, you know what, I go to bed early. Don't call me after 4, call me in the morning. Make sure everyone's aware of that, put it in the somewhere in the EMR that everyone's able to see that, and they know to call the patient on the day of a visit. Additionally, provide a window for when you will arrive. So you don't want to give a window of too wide of 4 hours. Patients will want more of that narrower window, but also you don't want it too tight of 15 minutes. Usually within a window of 1 to 2 hours is what we usually say. And then if you're running late, so if you get done a visit, you told a patient you would be there between 12 and 1, and the house you're at now, is 20, and will take you 20 minutes to get there, but you don't leave that house until 11:50. Call the patient before you begin to drive and say, hey, I just left my patient's house. I will be there in a little bit. It'll be about 20 to 30 minutes, but keep them aware when you're late, because if you're running late, they may call the agency and ask where their nurse, therapist, or aide is, but it just keeps the patient aware of what is happening because we are heading into their home. Asking about if teaching was provided in an easy to understand method. So one way to do this is asking the patient to teach back what was taught. So you review a medication, asking the patient to tell you about the medication, when to take it, the side effects of that, how often, but making sure that the patient understands that. This means that they at least understood what we had reviewed along with them. And additionally, any materials that we give in writing, we want to make sure it's actually at an appropriate reading level. Studies have shown that over half of American adults read below a 6th grade level. So we want to make sure any information we give them can be easy to read, and they will read that. If patients aren't reading what we give them, whether it's about meds, whether it's about exercises, whether it's about disease and management, this could lead to a lower compliance rate and have them going back into the hospital because they're not compliant with meds, diet, exercise, whatever we provided them. So by making sure it's at a level that they can understand, we can help to improve an HCAHPS score, but also to reduce hospitalizations as well as harm to the patient. And then, did the agency seem to listen carefully? Ways that we can demonstrate this is repeat back what the patient had said, demonstrate active listening by asking them more to go deeper on questions or to clarify it. And then also to put away the device, close the laptop, tablet, whatever's being used. At some point in the visit, put it away for just 5 minutes and just talk with the patient, really engage with them, talk about whatever it is, whether it's meds or exercises or their disease or whatever their pet, but really engage with them to connect along with them, to demonstrate that we're listening to what their concerns are. Then the last two in this one asks about, did you get the help you needed when calling the agency, and how long did it take? So to look at this and how to score these well is, did you get the help you needed? Well, consider who answers the phone. So when a patient calls in, is it a receptionist? And how do they answer the phone? And do they know where to send that? So if it's all the calls are routed around through intake, scheduling managers, everyone in the office, well, who's answering the phone? Are we able to track down to see, where could we improve in these processes? And then how do they answer the phone? Do they say who they are, the agency that the patient called, so the patient knows they called the right place, answering the phone with a smile? It can be heard that we're answering. If the patient is calling in and it goes to intake's a busy place, especially on a Friday afternoon. So if they're calling in there, the person who answers may be trying to balance multiple referrals at the same time. And it can be hard for them to focus on that call. So having that coming into one area that can deal with the patient calls or to route whomever it is can be helpful. And then where do the calls go? So does whoever answers the phone know where to send a call about scheduling, or a patient wants to talk about a clinician? Do they know where to route those? And if someone's off, who is covering? So if a manager's off and a patient calls in to talk about a staff member or to cancel services, and the manager responsible is off, who's covering that can handle that? Make sure that that is clearly identified in the agency each day. And then how long did it take to get the help when needed? So following up with patients at the end of each day, even if we don't have an answer, following up and just saying, hey, I know you called, we're working on this. I don't have an answer yet, waiting to hear back from your doctor, the nurse, whomever it is. We will call you first thing in the morning, as long as it is an emergency. And then also, what are the patients calling about? Are there tip sheets, resources, other items that we can create that we can hand to them about meds or diet or exercise? Is what can we provide so that the patients have it, so they don't need to call and wait for a response? The next composite group is about team discussion and specific care issues. All of these, the most positive response is yes. So you definitely want to see a yes in all these items here. So they ask about home safety, pain management. When we're talking about home safety, how to try to score well here is inform the patient why we recommended a change. So why are we asking to remove their throw rugs or making sure there's a lighting? This is really to prevent falls, to keep them safe at home. So once patients understand the why behind it, they may be more likely to implement those actions. One, it demonstrates that we did address home safety with them, but two, hopefully it prevents any adverse events. So talking with them, and this isn't only done on that start of care, but it could be done throughout that whole episode of care, so that we're addressing these over and over again as things change. Pain management, we want to talk with the patient about pain and ask, did anyone discuss pain? But saying the word pain, patients may say, no, I don't have any pain, but I get a headache every day. Well, that's pain just by a different name. So use synonyms. Are they experiencing any discomfort, any aches, soreness? Using these words may be able to explore more about pain management. And we don't have to say to the patient, oh, you said you have headache, that means you have pain. It's how can we address this? We want to, alleviate any of this suffering as much as we can. Also asking about, do they have issues sleeping, problems concentrating, or any other impacts on their daily life? Maybe they can't put on their socks and shoes because when they bend over like that, their back hurts. So that's pain. How do we help to address that? So items that we want to include using the synonyms there. The next item to ask about medications. There are 5 of the 7 in the team discussion specific care issues asking about medications. So talk about the patient's meds, ask to see all of these. And we may have to ask multiple times in a different way. And we may need to say, okay, we want to see all the medications that you take. And we may have to explore more is, well, is there anything that you take to help you sleep? Anything in your bathroom, anything upstairs on the nightstand? What do you do when you have a headache? Asking about this in other ways to help identify any meds that they take. And then after they've gone to a provider, ask about any meds. Was there a change? Was anything added? Was anything removed? We should be discussing medications every visit. Was there a change? Is there anything new? We want to address this each time. And then talk about the purpose, when to take it, and the side effects. These are the words used in the survey. They're common words. Use these words. The side effects of your medication is this. The purpose of this medication is to lower your blood pressure. This is when to take the medication. Use these words and provide it in written information so the patient is able to reference that when they get the survey. These are standard words that can be used in the delivery of care. When we get to the standalone items here, and the first one asks about the overall rating of the agency. A 10 is the most positive response. And then, would you recommend this agency to a family or friend? Definitely yes is the response that we're looking for there. So what we want to see, ways that we can work on this is, over the course of the care, just ask the patient, are we meeting your needs? Is there anything that we can do in a different way to meet your needs? We can't ask anything specifically. We can't verbatim ask any of the questions in the survey, but we can ask, how can we better meet your needs? And then we can also ask, how can we improve our services? What can we do better? This will help to, one, help for the next patient, but it shows the patient that you do want to improve as well. So just want to review some of the prohibited actions here, what you cannot do regarding the HCAHPS. You cannot give the survey to patients. You can give it to staff so they know what it is, but you cannot give a copy to patients. You cannot include verbatim words or phrases from the survey in promotional materials. What I had just said about the meds, the side effects of meds, that's a common phrase. The side effects of this medication is lightheadedness. That can be used. We cannot attempt to influence responses. We cannot say, we're really hoping that you score us a 10. We cannot offer incentives to participate or not to take part in the survey. And we cannot help the patient to answer any questions, no matter, even if they ask. They may say, I'm not able to read this. We can guide them to say, oh, if you have a family member that can help, they definitely can, but we can't. We cannot ask why a response was a given. So really key, just make sure that staff are aware of this. So what can we do? We can inform the patient they may be asked to respond to a survey, but every patient must be notified of this. This can be included in an admission packet that says, you may get a survey, please take the time to fill this out. We can ask questions to promote well-being. Did you understand what we reviewed? Teach it back. These are safety issues. Do you have any additional questions? We want to make sure the patient is able to remain at home safe. And then we can ask, how can we communicate better? We want to deliver service in a way that meets the patient's needs. So I know we're right at time now at 11:30. Just to summarize here, educate all your staff at least annually on customer service practices. Provide all staff a copy of the survey so they know how they're being measured. Reinforce it's a measure of the way of their service, not the practice. And then review processes and common scenarios, scheduling meds and these items. My contact information is here. If you have any questions, feel free to reach out. Thank you again for taking the time with us this morning.